Hello friends, myself Dr. Manish Agarwal, practicing as a diabetologist and metabolic physician. My area of the interest is diabetic, thyroid and obesity and hypertension. I am going to talk just in why India is a capital of the diabetic and what is the reason and how to prevent the diabetic and pre-diabetic populations from the India. At presently, 79.2 millions according to the IDF and ICMR, they are suffering with the diabetic, either they are taking the medications, either they are on the insulin. First we are going to discuss type of the diabetes. Usually three types of the diabetes. Type 1 diabetes means juvenile diabetes, less than 20 years age, and they are lean and thin and they don't produce the insulin they need of the insulin, is a type 1 diabetes. Most of the patient is a type 2 diabetes. Out of 100, 95% they are type 2 diabetes, means insulin resistance. And because of the diabetes related to obesity, Indian and genetically we are more prone to the diabetic. What's cause of the diabetic and what are a risk factor of the type 2 diabetic? Some of the risk factors are reversible, some of the risk factors are irreversible. And I'm talking with the irreversible risk factor, family history, genetical history. These are some of the irreversible, and reversible means age, obesity, smoking, hypertension and cholesterol, some of the reversible factors. These are responsible for development of the type 2 diabetes. And some third type of the diabetes is a gestational diabetes. Diabetes in pregnant women. These are burning issues, particularly India, and we are seeing of the out of 10 women who are pregnant, they are suffering, 2% are suffering the diabetic, or already they are some of the pre-diabetic before the pregnancy, they can convert into the diabetic. These are some of the big issue of diabetes. Is a slow and dynamic and progressive and inflammatory disease. Number of patients is coming with me, they are asymptomatically, they are not knowing signs and symptoms of the diabetes. So I am requesting of all the Indian and genetically age of the 30 years, they should get the annual blood sugar checkup, fasting, postprandial, and last 3 months of the HbA1c should be done. One cardiogram, lipid profile should be done annually of, on particular who are having the waist circumference, if the 80 centimeter in female and male is more than 90 centimeter and having the some of the family history and genetically, they should get of the every yearly fasting blood sugar and postprandial after the 2 hours of the food, they should get the blood sugar. Why? Diabetes can be prevented. Some of the diabetes can be reversed by the diet and exercise. Suppose we are not keeping the sugar control, we are not keeping the blood sugar, fasting blood sugar less than 100 milligram deciliter, and postprandial blood sugar is not keeping the less than 140 or 150 milligram deciliter. Some of the patient is having, they are more prone to the stroke. Stroke 2 to 4 times more common in stroke in diabetes. Retinopathy, blindness are more common in diabetic rather than a non-diabetic, and periodontitis, dental infection are more common in diabetic. Heart attack 2 to 4 times are more common in diabetic, and lungs, these various infections like the H. pneumonia, tuberculosis, influenza, COVID are more common in diabetic. Itself, diabetic is immunocompromised and immunosuppressive stage of the, because your T and B cells are going to affect our immune system, are going to uncontrolled diabetes, and chance of the second infection are more common, and most of the patients are end up with the septicemia and multi-organs failure. Kidney infection are more common, where my colleagues nephrologists, they are seeing of the end stage of the kidney. Most common cause is still uncontrolled diabetes. Of the out of 10, 4 patients are end up with this particular chronic renal failure of the. These are some of the fetal complications of the, and some of the lastly is a diabetic neuropathy, and neuropathy means there is some of the nerves are going to the desensitized, or they are not susceptible to, and they are not recognized to the pain, touch, temperature, and ultimately they are end up with a diabetic food. In Indian scenario of the some of the study has done IDF, according to IDF and WHO, every 10 seconds, and we have to remove the one part of the leg, either the great toe or some of the amputation are doing. The most common cause of the amputation of the feet after the trauma or accidental, second cause is a diabetic. So these are some of the very fetal complications top to bottom. These can be prevented with the diet, exercise, monitoring, digitalizations of the diabetic and regular checkup. The number of patients coming with me, if my blood sugar is well controlled, why we should go to the doctor routinely after the 3 or 4 months. So I am going to request of all the diabetic patients, either that they are controlled or not controlled, they should visit the own doctor of the every 3 monthly should be checkup of the every yearly they should get the eye checkup, every 6 monthly they should get the dental checkup, once a year they should get the cardiogram to prevent some of the heart disease, urinary tract infection, kidney, serum creatinine, urine for albumin test should be done every yearly, and BPT peripheral Doppler should be of this particular. Most of the Indians of the particular they are having the tobacco or smoking. So I am telling all the diabetic patients, quite the smoking is a most fatal, and these are a reversible factor. We can stop the smoking of the body. So I am keeping this particular our books. I am giving my patient, be it the diabetes ki jang, Mediflame ke sang, co-partner with the Medilink Hospital, and for the particular our general practitioner in paramedical healthcare, I am going to publish this Medilink Times of the every 4 monthly to prevent the diabetic, how to prevent, how to make of the reversible of the diabetic by the diet and exercise. These are the very vicious, how to make of the A, B, C, D, E. A stand for the HbA1c, we should keep the HbA1c below 7%. B stand for the blood pressure, all the diabetic patient we should keep the blood pressure 120/80. C stand for the cholesterol, we should keep the cholesterol. There are two types of cholesterol, one is LDL, one is SDL. LDL is a bad cholesterol, we should keep the LDL cholesterol below 100 mg deciliter. D stand for the drugs to prevent the heart attack. E stand for the exercise. All the diabetic patients they should get the 40 to 45 minutes of the exercise daily, and 20 minutes should be yoga should be done. So viewer, and I am very thankful to the Mediflame. Is a very good portal with the telemedications of this particular COVID pandemic, because I will discuss of the diabetic patient, they are more prone to the secondary bacterial, viral and some COVID infection. They are worrying about to visit the doctor, clinic or hospital. They are more chances of some of the infection. They can use of Mediflame portal telemedications, and Mediflame is having the 25 specialty, having more than 250 doctors of the various specialty. So I would like to request all the senior citizens who are diabetic, they can use this very good Mediflame telemedication. Jai Hind. Thank you.